Before we begin, I'll be doing a brief introduction on the structure of today's webinar entitled Beyond the Headlines, the Current and Future Impact of COVID-19. For those of you that are new to Zoom, our experts will be sharing a presentation and then answer questions from the audience towards the end of the session. We suggest you have the speaker view option on in order to view the presentation properly. We also suggest you keep your video turned off. Throughout the duration of the presentation, you will automatically be muted. If you wish to ask a question, you can type them in on the chat feature on your Zoom window. We will try to get to as many as possible during the last 20 minutes. Please make sure to be respectful towards one another on the chat and only ask relevant questions. This session will be recorded and we will be posting the recording on our website at the following link on the next slide. It's metropolitan.fiu.edu/COVID-19. Please note that today is the first in a series of presentations that our center will be facilitating to discuss COVID-19's impact on the South Florida economy. Successive sessions will be taking place each Wednesday at 10 a.m. for the next 4 weeks until May 6th. Today's presentation will provide an overview of the FIU Jorge M. Perez Metropolitan Center's comprehensive research initiative and the first installment of COVID-19's current and future impact on our economy in South Florida. We will not be covering the CARES Act or how to apply for relief. Our goal is to provide an understanding of how South Florida will be affected economically using data analysis and trends, as well as how to plan for changes. We'll see your conversation on the topic being important to the research initiative as we move forward. I will now turn the mic over to our center's director, Dr. Howard Frank, who will be introducing the center and our expert researchers.
Thank you, Helen. Good morning. I'm Dr. Howard Frank, director of the Jorge M. Perez Metropolitan Center, a vital part of the Stephen J. Green School of International and Public Affairs at FIU. Thanks for joining today's webinar, Beyond the Headlines, the Current Future Economic Impact of COVID-19. Trying to make sense of critical issues was one of the reasons our center was founded in 1997 as an applied social research branch at FIU, and we're dedicated to informed public policy in the region. Since then, we've grown to become South Florida's leading urban think tank. Our work has 4 pillars: economic development and housing policy, performance management, evaluation and survey research, training, and applied economic and demographic research. Decision makers in the public, private, and nonprofit sectors turn to us for thought leadership and policy guidance to improve their organizations and communities. We are evidence-driven and dedicated to enhancing the quality of life in our region. We take pride in our contribution to FIU's national recognition as an engaged university. Now, let me turn to brief biographies of our presenters, Dr. Ned Murray and Dr. Maria Ilcheva. Dr. Murray is Associate Director of Research for the Center. His expertise in economic development and housing is nationally recognized. Ned has authored numerous studies throughout the region and state with distinctive competence in affordable housing. Dr. Murray is a former practicing urban planner in Massachusetts, where he earned his PhD in urban and regional planning from the University of Massachusetts at Amherst. Dr. Maria Ilcheva is Assistant Director of Planning and Operations and a proud Panther who earned her PhD in political science. She is our resident methodologist who applies her skill set to a wide range of policy issues, including wages and compensation, economic sector analysis, and workforce development. Dr. Ilcheva also directs our Census Information Center, which is a direct affiliate of the US Census. Before I turn the virtual mic over to Drs. Murray and Ilcheva, I'd like to take the opportunity to thank my 2 colleagues, Ms. Helen Roldan and Ms. Caroline Bernard-Stokes, for arranging this event in near real time. Dr. Murray, quickly, if you look at our work, and it is very, very broad-based. The 2 common themes are applied demographic analysis and a deep concern for building an inclusive and sustainable economic base within our region. With that, I will turn it over to Dr. Murray. Thank you.
Good morning, everybody. I hope you're all doing well during these strange times. When this issue first arose, the center's researchers, we sat around a table and realized that there'd be considerable requests based upon our economic development background and work we do in prosperity studies, disparity studies, and housing studies. So we decided to, about a month ago, to develop this or design this research initiative that would be comprehensive and really try to quickly grasp and try to get our arms around the research questions that would guide the research initiative. This involved an extensive review of previous economic shocks and pandemics. And we have found from the research, quite frankly, that there are various accounts, including historical accounts, of course, public health accounts, economic accounts. But as both Dr. Chaver and I will be bringing up at certain points during the discussion this morning, there isn't a real body of research that can point to what is going on right now. And that's really for two reasons. Number one, there's never been anything quite like this in terms of industry shutdowns or near shutdowns. And these are our major industry sectors here in South Florida, which also are our major employers. So the rapid job loss has been considerable. In the Great Recession, as we all recall, not too long ago, we lost 10 million jobs in the first 2 years. With this, we lost 10 million jobs in the first 2 weeks. So there's a level of economic shock that is really quite staggering and did provide some real consternation in terms of our researchers, in terms of how we get our arms around it. But fortunately, the hallmark of the center's research over the last 23 years has been the South Florida economy and its industries and its workers, issues such as prosperity and disparity, and of course, working with local governments, nonprofits, understanding what those strategies need to be in order to address those issues. So we felt we were equipped to take this on. We thought it was our responsibility as a major public university and think tank to do this. And so that's what got it all started. Finally, though, let me say this. You're going to hear the words, and you already have, unprecedented and uncertainty. These are two words that, quite frankly, make researchers cringe. So that's what we're dealing with. So there has to be built-in flexibility. The dynamics of this research is quite amazing, because we are looking at weekly job numbers and monthly job numbers, and we're looking at ongoing issues relative to the stress that this is creating on our populations and our local governments, and obviously our local businesses. So we, as Helen Wildan had said at the outset, this will be the first in a series of 5 webinars, but we'll be also producing a number of different other products, including infographics. We have several on our website already, and some policy briefs, as well as the larger research, which we hope can be completed over a period of several months. Moving on, the scope of the research was once again decided among the researchers once we began to get our arms around the issue, and the understanding that the issue is so deep as far as what community is all about, the economic functions, the social functions, of course, of community, and obviously the impacts that are occurring right now, but also the impacts that we'll be seeing down the road. So we thought the most important thing to do, number one, was to look at the economic impacts on South Florida's most vulnerable industry and employment sectors. and Dr. Ocheva will be providing those preliminary findings um, in a bit. The other way of looking at this, of course, was the social environment impacts, which are obviously quite staggering as well. Some of these have not played out as of yet, but there's been already certainly discussion and media reports on how people are struggling from a social standpoint, including the issue that we've already been struggling with in terms of affordable housing. So we are looking at that, and we give credit to the Miami Herald reporting and South Florida Regional, the South Florida Business Journal, and others media outlets for already looking into this and showing that link between job loss and different occupation groups and distress relative to affordable housing. And then the third point, which is so critical, is what are we going to do? How do we plan for that? And that's going to be a focus of my presentation a little bit later on. And I think probably one of the most important parts of this research is what are the response strategies that we need to develop. But first off, I do want to get back to the economic impacts, and we looked at that, providing that baseline analysis, which Dr. Ocheva will go through. Beginning with the number and location of business establishments, obviously the products and services that they provide, their output and values and occupations and wages, the supply chain analysis, and undocumented workers, which is going to be a really important part of our research as well. I should also note that while the economic function of communities is foundational, we know its level of economic functionality will determine the level of social development in a community. So we're going to be connecting these two all along and bringing in other experts who can look at this as well and provide you with their understanding of these socioeconomic impacts and even larger community impacts resulting from basically the destruction right now of our economic base. And it is true that pandemics, based upon our research, are fundamentally interdisciplinary in scope. We do understand that, and we're going to try to focus on mainly the economic and social impact, but there are a lot of other things that we'd like to shed some light on, and we will shed light on. But we also want to make it clear that we're not providing every single research question or every single solution, but we are focused on the areas where we have particular strengths, and of course that is the economy and of course the social environment. But certainly we'll be shedding light on these other areas and bringing in experts as well. And then lastly, the economic shock that we're facing, as I mentioned, is really unprecedented. And the response strategies will absolutely be vital to each community's recovery. This is up to each community. Obviously, economies are much larger than that, and more regional in scope, but each community is going to have to deal with this. Some communities are going to be impacted more than others, but the South Florida economy, as Dr. Ocheva will get into, is very much the same in many ways. But this is going to be a community response, and it'll have to be in order to take on the magnitude of the economic shock that's occurring in not just communities but in neighborhoods here in South Florida. So this can't wait. The social responses, the economic response strategies are going to require a lot of work, and we have a lot of work to do in terms of preparation. So with that, Dr. Ocheva will get into some of the specifics of the economic analysis.
Thank you, Dr. Murray, and good morning, everyone. Thank you for joining us. As the previous speakers already mentioned, with this research, we intend to fill some of the knowledge gaps that may emerge related to our economy and help decision-making in the COVID-19 aftermath. So in the next few minutes, I will present some of the characteristics of our community, economic, social, and others, that we chose to highlight for this webinar, with the understanding that they are not exhaustive to what's occurring in our community. And I also want to note that the virus has accelerated many of the processes that were already underway. It also exposed economic and social vulnerabilities that we have studied for a number of years. We and others, I'm sure you know, have been talking about sustainability, resilience in our community, and the indicators we present in our studies, and some of which we will outline here, have a direct correlation to our ability to weather and recover from natural disasters, health epidemics, or other systemic shocks. Given the diverse regional representation of the group of participants we have here in this webinar, the information I will present is on the South Florida region, or as we call it, the Miami Metropolitan Statistical Area, which includes Miami-Dade, Broward, and Palm Beach counties. Of course, all the analysis can be done for individual counties, cities, and even neighborhoods or specific zip codes. With that said, let me start with some of the building blocks of the South Florida economy. These are some of the very important regional characteristics that we are monitoring and will continue to monitor in the upcoming months. First, between 2014 and 2019, the region's population increased by about 6%, growing by almost 350,000 people. And prior to the pandemic, the population was expected to increase by another 4% between 2019 and 2024, adding close to another 250,000 residents in our region. Within the same 5-year period, jobs increased by 11%, from about 2.6 million to over 2.9 million. This change, I should note, outpaced the national growth rate by about 4%. In terms of numbers, that means another almost 300,000 jobs were added over the last 5 years. The growth, the job growth rate was projected to be high as well in the next 5 years. As the number of jobs increased, labor force participation also increased by about 1.5% within the same period. And of course, we know that unemployment was less than 3% prior to the virus. Another indicator that we'll look at is the gross domestic product of the region, which represents the final market value of goods and services produced in South Florida. The $364 billion of GDP for South Florida represented 30% of the state's GDP. That includes about $222 billion in industry earnings, $31 billion in taxes on production and imports, and over $111 billion in profits for the private sector in South Florida. Another aspect of our economy that we're monitoring is related to the types of businesses we have, occupations of workers, income, and industry sectors. Most of our establishments are service-oriented, as you well know, and the sectoral distributions are also linked to the earlier point I made on the size of establishments. The average size of a business in our area is about 14 employees. This has obvious consequences about the support system and interventions that we need to put in place to address the economic shortfall that these businesses are experiencing. The types of businesses we have explains the high presence of service occupations in our workforce, and half of our workforce is in just 5 occupations that you see on your screen: office and administrative support, sales, food preparation, transportation, and healthcare. The median hourly wages in these top 5 occupations ranges from $10.50, these are 2019 figures, per hour for food preparation, and on the in the upper range we have about $30 for health practitioners. Other occupations with over 100,000 employees include management, business and financial operations, education and training, library occupations, construction and instruction, and extraction, and a few others. In 2018, linked to the types of occupations and the wages that these occupations pay workers, the median household income in the Miami metropolitan area was just over $54,000, which was $6,000 below the national median household income. I also want to note that our per capita GDP was about $58,000, higher than the state per capita GDP, but lower than the national. In other words, based on population size, our region provides tremendous value to the state economy. The development of successful strategies to address the economic challenges we're experiencing in South Florida is dependent on our understanding of who lives and works here and the types of economic activity of our businesses and workforce. Almost half of our region's private employment is in the top 5 sectors of healthcare, retail, hotels and restaurants, administrative, professional and technical services. Again, as I mentioned earlier, service-oriented sectors. The government sector that you see in the bottom of this chart includes the public administrators in our region, as well as federal and state employees, and public schools and hospitals. All of these are included in this cumulative count of the workforce in that sector. In terms of GDP, finance and insurance, wholesale trade, the table on the right of your screen shows that these, the top sectors, the top finance and insurance, wholesale trade, and professional and technical services account for almost 30% of our region's GDP. The top 10 sectors you see account for about 3/4 of our region's GDP. All of this data represents indicators that speak to the strengths and weaknesses of our economy. Using some of these characteristics, we conducted economic impact analysis of just two industry subsectors. We've heard the multiple reports about job losses and sales losses in these sectors. So we just selected these for the purposes of showing you impact of just these two sectors, hotels and cruise lines. Hotel occupancy has plunged, as you've heard, throughout the region, with many hotels either completely closing or operating at diminished capacity. Occupancy has, over the last week, has ranged throughout the region from, with Miami-Dade showing about 20%, 24% occupancy in Broward, and 21% in Palm Beach. Considering the lack of this data, these are just numbers from last week, we can anticipate it's very likely that occupancy will decrease in April. And for purposes of the model, we assumed 15% occupancy for the region, which corresponds to 85% loss in sales. Again, we can play this with multiple scenarios, but these are some of the numbers, the realistic numbers that we can expect to see. So for every month that hotels in our region in South Florida are only making 15% of the sales that they typically make, there is an overall $411 million cumulative loss to the South Florida economy. Now, this is not just loss to the hotels, but input-output modeling allows us to see how losses in one sector also affect other sectors. This is what input-output modeling does. It estimates the ripple impact. For example, the decrease in sales of hotels and cruise lines leads to a decrease in demand from suppliers, which in turn leads to a reduction of revenues for those businesses. And it also reduces employment, incomes, and consumption, household spending. All of these are part of the impact analysis. For cruise lines, the effect is also substantial. For them, we're looking at 100% loss in sales, which leads to monthly loss in earnings of about 303 million. And obviously, you've heard the reports that based on their the foreign registration of their ships, the loss in taxes is smaller than for hotels, even though we know that they play a major role in our economy. So the impact of revenue losses in just those two sectors is indicative of the massive economic shocks and ripple effects of the pandemic on our South Florida economy. Beyond the direct economic shocks, there are some other social environment impacts that we're monitoring, and Dr. Murray and Dr. Frank mentioned that we try to look at the overall impacts, not just narrowly focusing on job losses or wage losses, but see how it creates an even stronger negative impact on residents, households, businesses, etc. Under the umbrella of social justice, we're considering the uneven impacts of the virus on different segments of society. Some groups, such as migrant workers and workers in the informal economy, are particularly affected by the economic consequences of the virus. And women who are overrepresented in the public health sector, for example, are particularly exposed to the virus. In our annual Status of Women reports for Miami-Dade County, we also highlight the lack of pay equity and the difficulties female-led households with children face in terms of poverty, healthcare access, childcare, and others. Additionally, over the last month, we found out that over 60% of the positions that have been eliminated in the South Florida economy are traditionally occupied by women. Many workers in our communities also encounter the work or lose your income dilemma. Part-time workers, many of whom are women, temporary workers, or workers under short-term contracts, digital gig economy, are frequently eligible for unemployment benefits or income support. These challenges also put additional strains on our already strained social service system. The virus has disrupted the normal channels through which people seek help. We continue hearing about the challenges of applying for unemployment, but it goes beyond that. Social services such as food distribution, in addition to health concern, the health concerns obtaining healthcare are mounting. While many services are provided by governmental agencies, many of our community's needs are also met by the nonprofit sector. In February, we completed a report on the nonprofit sector in Miami-Dade County, which outlined the needs that these organizations address and their capacity in terms of revenues and focus. But we are aware that a large portion of these nonprofits are funded from government grants, their own fundraising activities, and donations. Our current situation precludes many of the nonprofits from engaging in planned fundraising, which in turn diminishes their capacity to address community needs. We have a strong nonprofit sector, and we have large nonprofit organizations that are creating relief funds and different funding streams to support their nonprofit partners. But it is quite likely we'll experience these economic shocks in the nonprofit sector as well, not just the private economy. One of the effects that we're also considering is how social distancing will impact voter behavior. As a political scientist, that's a personal interest of mine as well, because beyond the apparent health, social, and economic implications, COVID-19 is also likely to have far-reaching political impacts as it impedes the normal functioning of institutions. The spread of the virus has already led to the delay of primaries in 15 states, created controversy around elections in others, like Wisconsin, and has instigated discussions about virtual national conventions. These responses raise many questions related to the effect of the pandemic on institutional response and voter behavior. Without significant interventions, COVID-19 would suppress voting in the presidential election. In the aftermath of the virus, will voters be reluctant to vote in person in traditional, in the traditional precincts that they typically do? Do states and localities have the capacity to ameliorate the potential low in-person turnout through other voting mechanisms? These are some of the questions that we will look into answering, thinking about elections and political impact. Another consideration that both Dr. Frank and Dr. Murray mentioned is how COVID-19 will affect government operations and revenues. I mentioned earlier lower taxes that we can expect will be collected as businesses are shutting down or decreasing operations. While our South Florida governments have experience with emergency management, the natural disasters we deal with are typically short-term, immediate impact, and then followed by recovery. We're in a different world now. The extended and uncertain time frame of this health disaster necessitates new tools in terms of technology, new strategies for deployment and contact because of social distancing, and probably a much larger demand for services. And the final point I will make is related to the possibility of this period of combined uncertainty, economic shock, and health impacts continuing through hurricane season. The early forecasts, that message has been a little bit lost in all the negative messages that we hear nowadays, is that we may have an above average hurricane season with 16 named storms, 8 of them becoming hurricanes, and 4 probably becoming major hurricanes. Hurricane season begins on June 1st, so it's not that far in our future. In our research on hurricane preparedness and mitigation, we've consistently shown that South Florida has a full sense of preparedness, with most people lacking the basic necessities recommended to weather a storm. That lack of culture of preparedness may be compounded by the added financial stress on households. And in our research, we'll continue looking at those additional impacts. Of course, there are many more directions in which we're looking, including impacts on the residential and commercial real estate markets, education, crime rates, etc. But I will stop here for now, and I will pass the screen and the microphone to Dr. Ned Murray again to talk about how we can begin addressing these challenges.
Thank you, Maria. Once again, to remind the audience, what we're providing you today is really the framework of the research, and you're probably getting an idea of how broad it really is, how comprehensive it is, because it does have to address so many issues that are being impacted, not only economically, but socially. These next few slides, though, do get into what we think is probably going to be the most important discussion going forward, and that is, how do we begin to plan for the post-recovery, whether that be 6 months from now, 9 months from now, 18 months from now. The idea is a more resilient post-COVID-19 economic development planning response has to begin now. We cannot wait. And I know we have a lot of folks in the audience today from representing local governments, nonprofits. This applies to you in terms of your own strategic planning and the strategic responses that you're going to have to begin thinking about. But it has to begin now. We have to be proactive, not only for competitive and for other reasons in terms of our revenues and other issues like that, but for various restorative reasons that we need to address our working population and our communities that are really going to need a jolt as we come out of this. Moving on, as I had said before, and Maria had reiterated, there's nothing we can really compare this to, but as the research is becoming more evident, and what we're seeing on the media, why we hear public health professionals say that they haven't been able to sleep at night over the last decade, we now know. Once you do the research, you realize that this was in the works. This is not just something we're going to be dealing with now, but down the road. For those of you who have done your own research, you do know that the Spanish flu of 1918 killed 675,000 Americans and about 35 to 50 million people in the world. I think there was about a third of the world that was actually infected. This issue is still on the minds, has been on the minds for particularly people in the public health field and epidemiologists and others for some time. And I think from going forward, it's going to have to be on all our minds. What are we going to do? Well, the first thing we need to do is to begin weighing the economic and social impacts and trends. So we started doing some of that. Maria, Dr. Chaver had provided some of that information, but we do need to dig even deeper. I had mentioned earlier that we've already lost 10 million jobs. That's in 2 weeks. We're starting to see numbers in the 15 plus range after this week. So we need to look at this. And in looking at that issue, there were really, it's really a threefold dimension that we'll be focusing on in terms of existing factors. One is how is the economy and its existing impacts, if it's prolonged, we have a sense, based upon past recessions and even the past pandemics and the Great Depression of the 30s, that considerable industrial restructuring will occur. And also changes in terms of labor demand. And now this starts to get into some deeper stuff, but once again, I'm just trying to provide you the framework of what we're looking at. But these are real issues: industrial restructuring, labor demand as we go forward. Some of that's already happening. Will existing trends maneuver or accelerate? In all likelihood, they will. Certainly accelerators such as remote working and learning, work shifting, which we've been writing about for our last several studies, working with local governments. The whole work shifting trend will certainly accelerate. Retail buying, and then thirdly, the global response. And we're going to get into that a bit, but there will be a global market response to this, which we will talk about. Now, Dr. Chaver mentioned the impact on undocumented workers. This gets into the socio-economic and racial disparities that we're already seeing played out. We're seeing disproportional health impacts on minority and poorer communities. Well, this is also going to play out more longer term in terms of economic and social distress. So we really want to focus on that going forward. And then, of course, this issue of uncertainty. How long does this go? So our research is going to look at it in terms of whether it be 3 months, 6 months, 18 months. But most importantly, what we need to do is start thinking is, given what we know and given existing trends, how do we plan for that right now? The next thing we need to look at is, what do we need to determine based upon that? Well, we're already looking at vulnerable industries and employment sectors, as Dr. Chaver just went through. We're looking at other types of activities, including commercial real estate activity, certainly the housing issue, which is such a big issue in all of South Florida in terms of affordability, but commercial real estate activity more in general, lending, private and business lending, of course, huge issues right now. Public infrastructure, this is going to be a huge one, especially given the fact that we're going to have to prepare for hopefully some level of industrial development or reindustrial development going forward, which I'll get into in a minute. But as a former study we had done showed, this was the digital divide study the Metropolitan Center did back in 2015, 37% of households in Miami did not have adequate or have no access to internet services. 37%, which is one of the highest rates in the country. We need to be thinking about going as we go forward in terms of public infrastructure, not just the normal types of infrastructure in terms of water and sewer to provide for industrial redevelopment, but what it's going to require as we begin to work more remotely, learn more remotely in terms of bandwidth or internet speed. What's that going to look like? That's going to be a major infrastructure concern. We've already brought that up in several of our studies relative to work shifting, so we need to focus on that, as well as the digital divide. And then the response strategies. Everyone who's represented here today representing some local government, a nonprofit institution. We need to be thinking going forward how that is going to play out and begin thinking about that right now. We have no time to wait. Then we need to be really kind of focused on building more resilient local and regional economies. So what we're calling this is reindustrialization with human face. What an opportunity we now have, given the vulnerabilities of our industries, given the cyclical nature of the South Florida economy. Even under the best of circumstances, we need to begin thinking about a resilient economic environment that will inspire investment in community, a resilient economic environment that will emphasize economic opportunity and prosperity. A resilient economy will explore new opportunities for small-scale manufacturing of diverse products, including the much-needed medical supplies and green energy products. This is happening nationally right now. So these are things that certainly South Florida can tap into. And then the resilient economic development approach will connect land use, transportation, housing, public infrastructure investment, and environmental protection. These are all things we need to be thinking about right now to create a more resilient economic environment, irrespective of a pandemic, but with the understanding that we're already vulnerable in terms of climate change, we're already vulnerable in terms of a cyclical economy that gets particularly hard hit, and now with the understanding that pandemics may be a part of the future. And then the issue of restart. Well, the issue of restart begins now, as I mentioned earlier. Begin planning the post-COVID economic and social environment. Number one is we need to find room for industry to grow, expand, and prosper. Industry has been pushed out a lot. We need to start thinking about how we preserve, how we expand our commercial industrial bases in South Florida. And what's really interesting about that is about 75% of the remaining industrial land in South Florida, going up and down the 95 corridor, is there. It's along the 95 corridor, which just also happens to be the locations of many of our more distressed communities. So some real opportunities there, but we're going to need to find ways to find room for industry to grow in this post-COVID era. Institutions are going to have to play a much more active role in terms of partnerships and investing in this type of resilient economy. So we need to begin thinking about how that gets done in terms of response strategies. Targeting municipal service and public infrastructure investments, I already brought up broadband, internet service, but we're also talking about other types of things that other measures, other strategies that counties and cities can do to make sure that areas where there is potential for reindustrialization, repurposing for commercial industrial uses in a more resilient economy, that they have adequate water and sewer capacity. We're going to be looking at more robust small business manufacturing assistance programs. If this is the way we need to go, which it is, so we need to talk about that more directly. Obviously, we're going to need assistance at the federal and state level, but we need to figure out how to do that locally. One thing we've learned in these last few weeks is, wouldn't it be nice wouldn't it be nice if we could handle a lot of these issues locally, whether it be small manufacturing of products, whether it be delivery of services, whether it be financing small businesses and homeowners and renters who would be impacted. Which then brings us to the final bullet, which is just rethinking workforce development. We can't continue doing what we've been doing because we really haven't moved the needle sufficiently in this regard. So we need to think about a more formalized and tailored workforce training strategy response that ties into what a resilient economy would look like. And what industries, what types of small scale manufacturing, what types of services that could be provided. And this, once again, has to be localized. In order to be resilient, you need to be localized. So these are some of the things we're also going to be looking at, is linking this all together in terms of what a resilient economy looks like, what are the pieces, what are the components, and this needs to play out on a community by community basis. This is not just something for the state of Florida to figure out, or any particular county to figure out. It's where people live. It's where they need to be working close by. This is what a more resilient economy looks like. So we're going to be laying a lot of this out. Obviously, once again, this is the framework. This is what gets us started. Over the next 4 weeks, we're going to drill down on a lot of these points. Obviously, we're going to have data on a week-to-week basis, and we'll be bringing in others, including professional experts outside of academia, in particular fields and professions that can speak to some of these issues as well. So with that, thank you very much, and we look forward to the upcoming discussion.
Okay, thank you so much, Dr. Murray, Dr. Chava, Dr. Frank. We're going to move ahead onto the discussion portion of today's meeting. And we have a few questions on the group chat. The first one was from Leopoldo. He asks, this will have a negative impact in our below ALICE, asset limited income constrained employed population, the most vulnerable in terms of economic mobility. How can we join forces to increase access to opportunity for these individuals in an intentional way?
Well, I will respond by what we just went through, the last few slides, and even the points that Dr. Chava made in terms of not just what are the most vulnerable industries, but who are the most vulnerable communities. And we have looked at this over the years with the prosperity study, which looked at that very issue of economic opportunity, mobility, and equity in communities that are most impacted under normal circumstances. And obviously they're going to be much more greatly impacted. So we think there's real opportunities here to do that. This is the time to do it. And that should be a real focus of what a resilient response would be.
Great. And Dr.
I just want to
Chava,
add to that, Helen, if I may have a minute. For those participants who are not familiar with the ALICE report, ALICE is an acronym that stands for Asset Limited, Income Constrained, Employed. It's a report that's produced every year for many states and counties throughout the country. And I'm actually on the Research Advisory Council for the production development of that report. And I just want to note that ALICE and other reports that we have produced, the prosperity study, many of the disparity studies that we've done over the years, and every economic development study that we've put out, it points out that many of these economic issues, and certainly including this economic shock we're experiencing now, it's not just something that the lower income households experience. The economic shock is truly pervasive, and it impacts what remains of our middle class. So it's not, we can't just say that's not impacting a lot of people, when in fact it is, and it's creating challenges for broad segments of our households. So when we talk about ALICE, we're not talking about individuals who are receiving social services and benefits. We're really talking about households that are in the middle income ranges, 60, 70, 80,000 household income, above the median for the county. And these are households that the ALICE reports and our reports show are also cost burdened in terms of housing, in terms of transportation, in terms of actually disposable income that remains after all the household expenses are paid. So that's the point I'm making, that it impacts everyone, and these strategies are not just for employing people, but for uplifting people who are currently working, adding the skills, the workforce development strategies that will allow them to progress in their careers and in their incomes.
Thank you, Maria. Rose asked if we're going to be sharing the recording once the meeting is over, and we are. We're going to be emailing everyone who registered a link to view it, but it will be on our website. The next question that I received anonymously, Maria, you mentioned informal workers. What did you mean by informal workers?
All right. There are many labels or names for the types of workers that many metropolitan areas have. The gray market economy, you may have heard, or workers who receive cash payments. It may also include undocumented workers who, again, are part of the informal economy, but it's kind of a catch-all phrase for those who are typically not officially on payroll with the company, and as I mentioned, because of that, they may not be eligible to receive unemployment benefits.
Raisa asks, what is the methodology for measuring the unemployment rate?
I can answer that as well. Typically, the unemployment rate is, I mentioned labor force participation, and it's linked to that indicator as well. The unemployment rate is the rate of people who are seeking employment but haven't been able to secure such.
How does the United States compare economically with other nations that are beginning to open to business? That is, those that have gotten beyond the peak in COVID cases and health impact.
We haven't. Our focus has primarily been on South Florida and the United States. But I would venture to say that if, as we hope, and many hope, the virus will gradually will either, I don't expect a vaccine will be found anytime soon, but because of social distancing, isolation, and other measures, eventually we will flatten the curve, and the shorter this time frame is between now and then, when we're able to start resuming normal business operations, the lower the impact will be. I showed in one of my slides the impact on the hotel and cruise lines. We don't expect that when we flatten the curve, all of those will, all these businesses will come online. Hotels will start selling rooms, or cruise lines start selling vacation packages. But the longer this period lasts, the harder it is for these businesses to come back, and the harder it is for people to feel secure. The more difficult it will be for people to feel secure enough to start spending. All of this affects consumption, household consumptions, and perceptions of safety, obviously, play a role in that. So we heard reports about China reopening, but if you see the images, they're not reopening in the normal way. People are still wearing masks, people are still keeping their distance, and that will have a role on our service-oriented sector. You can't open a restaurant, or you can't open a hotel expecting those same measures to continue that we have now. It is a difficult situation, and we certainly will be drawing these comparisons, but I think it's a little bit early for us to see the impacts of businesses reopening, or what the long-term effects will be.
Okay, and we're going to jump around. Someone asked, what are the impacts on higher education, student enrollment, funding, etc.? I think Dr. Frank might be able to speak on this one.
Hi. That is a good question. And I wish I had a great global answer for you, but I would make the following statement as we were, even prior to this, in our 8th year at FIU in without a tuition increase. And I think, again, consistent with the notion that this crisis may accelerate current trends, my gut says that is not just an FIU problem. That is part of an issue with affordability of higher education, and both private and public institutions have been loath to increase tuition because of the attention it's gotten in the student loan debt. So we were already going to be faced with a 2.5% budget cut this year. That was a few weeks ago. Now the discussion is 6%, and it would not surprise me if we are facing a 10% cut at FIU with the coming fiscal year starting July 1. And I'm not sure how the federal bailout, which I know part of it went to higher education, I really don't know how that will play out. I think consistent with Maria, with what she said, I think that's something we are going to probably have to be following, and it's consistent with Ned. I think it's a high degree of uncertainty. But again, I think it will accelerate trends. My department 5 years ago was 65% face-to-face, 35% online. Now it's the other way around, 35% face-to-face, 65% online. And it would not surprise me if in majors and programs that don't require lab work or a clear hands-on kind of delivery, it may be that for many programs, online becomes the norm. That would be something I would hypothesize, postulate. But again, I think my moniker for this recession is the great accelerator. And my view is it is probably going to accelerate a lot of things, and certainly in higher ed, more online and greater cost constraint.
This next question is for Maria. In the slide on the projections, Edward wants to know the $101 million loss in taxes for sales in bed. What's the projection period for that?
Sorry, what is the projection?
What is the projection period over the $101 million loss in taxes figure?
That is for just 1 month for South Florida. Yes, well, it allows us, and again, this is not just the loss of taxes from hotels or for cruise lines. This is the loss of taxes from other sectors that are impacted, and in turn, the loss of revenues leads to the reduction of their taxes. It's the ripple effect, as I mentioned.
Okay. Any insight as to what will happen to the future of retail? What about the lure of the urban core? Will people now go back to the suburbs or rural areas to maintain social distancing?
Well, I think that's one of the impacts that we'll be monitoring. And getting back to Dr. Frank's point, there were trends already in place, and his moniker, the great accelerator, I think plays out probably as much in retail as it does in anything, with the exception of learning, academia. So we've already seen that playing out, and obviously we've all had to use that method more recently, but we were also trending in that direction. So that's a big issue. A lot of our jobs, as Dr. Shaver had already laid out, are in retail, actual retail establishments that are located in all our communities. That downsizing and restructuring will continue at a much rapid pace, and we're already seeing it. So that impacts jobs, obviously. This is why we need to begin thinking about a more resilient economy. We can't, as we did in 2008, where we lost jobs in every single sector of the economy, and we are doing the same now. We cannot continue to do this. So we need to focus in on particularly those most vulnerable sectors that employ most of our population, and begin thinking of ways to transition into other economies, economies that are more, that can provide, whether it be production or services that can help us become a more resilient South Florida. So, and that's on a community by community basis. So that's really what we need to be doing, is thinking about that strategy response post-COVID.
Gloria asked, how will the research outcomes filter for practical application to ensure the insights are plug and play and they're not lost in the informational overload that we are already experiencing?
Wow, who wants to handle that one? Well, that's if I follow the question, that's one of the reasons why you have a think tank that has a high neutral ground in terms of our research. It's both cutting edge, but it is neutral, and it's up to us to communicate that through the media outlets that we have here, who have done a great job in getting the word out, but also through the university itself, and to find other means to broaden that. Obviously, the webinar today, and first of a series of 5, is going to help, but we need to figure out ways, to get that out, and to the questioner's thought there, that this, yeah, I mean, we're being deluged and on the news and social media right now on all these things. So we need to figure out a way to make sure that this information is getting across. We're so thankful that so many folks registered for this for the webinar today. It was closed within one day, and hopefully that'll continue. So we can just continue to get the message out. So I guess that's the responsibility for all of us.
Christina asked, can you please speak to the impact of immigration status? This is a major disruption. Folks are now eligible for relief programs, social safety net, visa holders who were sponsored by their employees who are now unemployed, etc. If I'm not mistaken, USCIS is open or closed right now, so that's another disruption.
I can take this one, and we certainly are aware that many of our residents are foreign-born. When we're not talking about undocumented workers, I'm assuming that that's not what the question asks, but it's asking for those who are either expecting naturalization or green card or some adjustment of status that will allow them to stay and work legally in the United States. We've looked at that in the past, at least try to discern for specific communities and for specific counties, how many do we have, how many people are waiting on adjustment of status. I mentioned earlier some population numbers. Certainly our population growth, we've shown, especially in Miami-Dade County, has been sustained by foreign migration. Over the last few years, that's been the bigger part of our growth, accounted by migration. And an economy cannot grow and prosper if people are not able to work. So we are aware that there are challenges. USCIS may not be completely closed, but they're certainly not running in-person appointments, citizenship exams, or any type of face-to-face interactions, and that is probably detrimental to the economic situation of many people. That's just yet another consideration that we need to make as a result of the closure or the suspension of many government services. Great question.
Grace asked, and William, I believe his question was related. Can speakers expand on strategy for rebuilding focus on manufacturing? Is it different from recommendations pre-COVID? And William asked, will there be a trend and a call to bring back American production?
Well, I think there already is, and we've done considerable research on this. This is my particular area of interest. It was what I wrote my dissertation on, was industry, targeting industries and clusters, and in a region where manufacturing was doing quite well up in central Massachusetts. But this is happening throughout the country and throughout the world, for that matter. We're not talking, Fordist levels of mass production manufacturing, but we are talking something post-Fordist, in this case post-COVID. But it's already occurring. We're calling it everything from small-scale manufacturing to micro mills and all these types of things that are occurring, and it's across different manufacturing products, which is quite fascinating. I mean, there are plastics companies that are pushing out electronic instruments and medical instruments, at the same time still producing combs and toiletware. I mean, that's how diversified like a plastic firm could be. But there's many others producing all types of products that certainly would be necessary and a part of a more local, resilient economy, is to have access to those and provide the jobs and the training in these areas of small scale manufacturing. We certainly have the land. We certainly have the underdeveloped commercial areas of South Florida where this can happen. We have the institutions in place, but all this starts now. We're not going to become even a small scale manufacturing region overnight. This will take months and months, if not year, in the planning, but it needs to start now. But it can be done, especially at the scale we're talking.
Great. We have time for one more question. For everyone who wasn't able to get their question asked, please feel free to email us. Like we mentioned earlier, this is the first in a series of webinars. So we're going to be doing webinars for the next, up until May 6th, for the next few weeks, every Wednesday at 10 a.m. Just stay tuned for how to register. Final question is, do you expect residents to move out of the more urban areas, further west, or move out of Florida?
Well, maybe I could begin, and Dr. Chaber, you could jump in. I think it's too early to make that call. Our suburban locations are just as dense now as our downtown. In fact, our urban areas are less dense than a lot of our suburban locations. I think the trend that we're envisioning, and we're seeing some signs of it right now, is that actually people are going to want to hunker down for at least a while. They're going to want to be closer to their families in their community. They're going to want to find jobs, or whether that be through home occupations or other types of work shifting closer by. In the short run, at least, what we think is there's going to be more of a focus on people staying put. How that plays out in longer term, we don't know, but at least for now, we think there's going to be much more home occupations, much more community focus, as opposed to people moving out.
And I want to talk about moving out of state. I think the question included that qualification as well. Again, I mentioned over the last few years, especially over the last 5 years, the bigger portion of our migration growth, and we're talking about domestic and international migration, has been accounted for by international migration. In Miami-Dade County, but now over the last 2 years, that trend started in Broward, and it's certainly accelerating in Palm Beach as well. We did see an increase of migration from the north as a result of tax changes and as a result of other trends. But overall, we've had quite a few people moving out of South Florida, more so in Miami, from Miami-Dade and Broward than Palm Beach counties. In times of economic shocks, as Dr. Murray mentioned, people will want to stay put, but I don't expect without a turnaround of how we look at economic development, how we look at workforce development and industry support in our region. If we don't have those interventions, I expect that trend, while it may be slowed down as a result of the economic shock now, it will continue on in the future. Again, it goes back to creating a resilient and sustainable economy where people will want to stay, where they will have the jobs, the financial resilience to support families and to have the disposable income that will allow them a good quality of life. The two main reasons why people move is jobs and housing. So if we don't solve the affordable housing challenge, and if we don't have jobs that pay wages, higher wages, then that trend of out-migration, domestic out-migration will likely continue.
Great, and thank you everyone for joining us this morning. Like I mentioned, we will be having a webinar next week as well, and for the next few weeks. Next week, we will discuss businesses in South Florida. If you have any questions, please feel free to email us. Our email is metcntr@fiu.edu. Have a great day, everyone.
Thank you.
Thank you.
Thank you all.
Great job, Helen.